welcome. We are practicing social distancing. I'm 6 feet away. I'm going to take this off so you can understand me clearly. My name is Lisa Mason. I'm the campus director for the Parma campus, and I'm excited to welcome you to our PTA virtual open house. Today's plan is to talk to you about Bryant Stratton College, talk about our PTA program highlights, our curriculum and clinical education, the NPTE preparation, our career services, admissions, and an opportunity for you to ask questions. Bryant Stratton College has been in existence since 1854, 165 years. Not many colleges can say they've been that old. We are regionally accredited, just like many of our peer schools, such as Cleveland State, Kent State, and Akron University, to name a few. I know all of you are here to learn more about the PTA program, but just to share with you, we do have many diploma, associate, and bachelor programs in other areas, such as human and legal services, business, healthcare, and our brand new electronics program that is starting in September. So sometimes, many people, now's a great time for a career change, and it's nice to go to school with a buddy. So if there's somebody that you know, I'm glad to hear about that. And I'd like to introduce Jody Frank, our program director for the PTA program.
Thank you, Lisa. Welcome, everybody. I am the program director for the PTA program here at Bryant Stratton College. I've been with the program since it originated in 2015. I was hired as the clinical coordinator and then became the program director about 2 years ago. So I'm really experienced with the entire process, from admissions. I teach many of the classes. I have placed students in their clinicals, and now as the program director, I get to oversee everything. So I'm really excited about the program. It means a lot to me personally because I have been here since the beginning. One of the things we're the most proud about is that 100% of our graduates have passed their NPTE, their licensing test, on the first try. Another highlight of our program is currently there is no waiting list to get into our program, which is different than many of the other area colleges. I know when I decided to change careers and go back to school to become a physical therapist assistant, I had to wait on a waiting list for over a year, even though I already had my bachelor's and master's degree. So we're really happy that qualified candidates can apply and get into the program and get started right away. With our program, we are CAPD accredited. CAPD is the commission that accredits physical therapy education, and in order to be eligible to sit for your license, you have to graduate from a CAPD accredited program. Accreditation is really important because it helps all of the programs maintain standards. So what you're learning in our programs and through your clinical experiences is what you need to know to work safely and knowledgeably when you're in the clinic as a PTA. One of the things that I really am happy with is we can only enroll 12 students per cohort, and having such a small class size allows 12-to-1 student-to-teacher ratio. So I get to know my students well. Dr. Fermanti, our clinical coordinator, gets to know the students well. So she can place them in clinical sites that are going to be appropriate for the student and the clinic. And with only 12 students maximum, there is plenty of hands-on time. There's plenty of equipment in the lab to use, so it's great that we can have such a small and close-knit program. We do have an integrated curriculum, which basically means that instead of taking prerequisites and applying to the program, you'll take those general education classes like English 101, math, anatomy and physiology, along with your PTA program classes. So instead of the program taking a long time, you can finish in 5 consecutive semesters. So you really might be able to start and finish our program before you would have started if you were on a waiting list for any length of time in another program. In each class, students create an authentic assessment. This is similar to a capstone project, and what these projects do is shows the connection between what you're learning in the classroom and how you're going to use that every day in the clinic as a PTA. For instance, one of your first authentic assessments is how to write a daily treatment note. As a PTA, you're going to be doing that all day, every day in your career. We have the students create exercise programs based on a case scenario, which again is going to be what you're doing in the clinic when you're a PTA based on the plan of care that your PT creates. We also have you do in-services as authentic assessments during your final full-time clinicals. During your last semester on campus, you'll present your portfolio, and what this does is highlights and demonstrates all that you've done and that you've really accomplished and achieved all of the program outcomes. So you will really have a good understanding of what you're going to be doing in the workplace. And I think students are happy to see what I'm doing in the classroom has an exact purpose for the clinic. We're not giving you busy work. We're having you create products that are the same as what you're going to see in the clinic. And speaking of clinic, we have clinicals, and Dr. Carrie Fermanti, I'll ask her to come up next, is a physical therapist, and she is our academic coordinator of clinical education. So it's her job to set all this up, so I'll let her take the stage next.
Hello, everyone. I'm Dr. Fermanti. I'm the academic coordinator of clinical education for the PTA program here at the Parma campus. I'm very excited to have you guys here to learn more about this career. It's something I'm very passionate about. This is actually a second career for me, so I love what I do, and I think that you guys are really looking into a career that's very rewarding. Part of what I do, I also teach classes, just as Mrs. Frank said she does, but part of my job is also to secure clinical sites for students, to secure contracts for our program to give you more opportunity, and then also to support you through those clinicals. So I'm in close contact with you and the clinical instructor and the site throughout your rotation to make sure it's successful for you. So throughout the program, you complete 4 rotations, 2 part-time and 2 full-time. So you can expect to be in the clinic within your 3rd semester of the program, which is great. So you get a little bit of knowledge, and you get to apply it to patients. We do have a variety of placements available, and they're continuing to grow. In fact, I just heard back from a site yesterday that is willing to affiliate with our program. We're very excited about it, and it may give students an opportunity to actually go into the operating room and see a spinal surgery. So you can see the patient all the way from the beginning to the end, which is a really rewarding experience to see that. With the 4 rotations, we do try to place you in 2 inpatient and 2 outpatient rotations. That way you're getting that well-rounded education, and when you graduate and you start applying to jobs, you can tell clinical sites, I have experience in acute rehab, or I have experience in outpatient orthopedics, and it just makes you a more well-rounded candidate, and it makes it easier when you're studying for your NPTE to have patients that you can really think back to when you're thinking through some of that material. During your clinical experience, I also pride myself, and I did not have this when I went through my doctorate program, where I will come and visit your site at least once every time you're in a rotation. I like to see what you're doing. I like you to know that it's an open door policy. You can tell me if you're having struggles or you're having successes. I can see you being able to apply the knowledge. And then it's a good time for us to sit down with the clinical instructor and make sure you are meeting the objectives so you can continue to move forward. And then here, I just wanted to show you guys a little bit about, for the people that are here, this is the room that you are sitting in currently. But for the people that are not here, this video is going to show you, this is our PTA lab. All of the classes and labs happen in this classroom. And I don't know about you guys, but going back to college, knowing that all of your classes are in one area is kind of a relief. You don't have to worry about where you're going, or you're always going to come to this room. What's great is you can see all of the equipment in the space that we have. So with 12 students, you have plenty of equipment here and plenty of room to be able to practice your skills. So we may teach a class, and then we're going to give you the knowledge on how to do a technique, and then we're going to have you practice it right away. So you're getting that visual and audio knowledge from us, but then you're getting the kinesthetic learning and the ability to practice and really hone in on your skills. We also do a variety of open labs. So if you feel like you don't get enough practice during class, you can come in during an open lab and you have access to all of the equipment, and we're here to answer questions and help you through that as well. Okay, I'm going to pass it back to Mrs. Green.
In order to be licensed as a PTA, you have to pass the board exam, which is the NPTE. And because it is such a high stakes test, we want to make sure that you are truly prepared for that. Like I said earlier, 100% of our graduates have passed on their first attempt, which that is something that very few places can state, and we're very proud of that fact. And some of the reasons why is because of how we prepare the students. During their last semester, they are in full-time clinicals, 2 full-time clinicals. There are 2 days where they come to campus. On one of those days, we bring in a company called Therapy Ed to present a 1-day review course. During the review course, the instructor goes over test-taking tips, types of questions, actually asks them some questions to test their knowledge, and then discusses how to set up a study program for the students. And then one of the textbooks that we require the students to buy during that last semester contains 3 online exams. So we have the students take one when they finish with all their coursework on campus to use as a baseline. We have them take a second test after the review course, and then from those 2 test exam results, Dr. Formanti and I sit down and we create an individualized study plan for the students. And then after they graduate, they're working on that study plan and take the final exam, send us those results, and so we can see, yes, they're on track to pass the NPTE, or maybe they need a few more resources to make sure that they truly understand a specific topic. Over the last 2 weeks, Dr. Formanti and I have been scheduling Skype calls with all of our graduates. We're talking about their study plan, making sure if they have any questions, we are answering them, providing them additional resources if necessary, because we want to make sure the students are confident when they go in to take that NPTE and do well on it, so then they can apply for their state license. Speaking of our graduates, I'd like to introduce Amanda. She just graduated in April of 2020. So Amanda, you can unmute yourself and a little bit of your experience with the program.
All right. Hi, everybody. So when I decided to go to Bryant Stratton, the 2 main things that I wanted from a PTA program were to be able to graduate within 2 years. And then my other biggest thing that I needed was I needed the attention. I needed a small class size. I needed to make sure that I was being able to learn everything that I needed to learn, and that I had the reinforcement from my instructors. So Bryant Stratton gave me just that. I graduated in under 2 years. I got as much reinforcement as I needed from both of my professors. I was able to go before class. I'm a morning person, so they really helped me out and allowed me to come before class to answer questions. I was able to even come before class to just work through some of the simple problems that I had during labs, or even during some of our coursework. So, and then it was great during clinicals. I was really matched with clinical instructors that really took in and considered the way that I learned, and it really helped my clinical experience completely. I really enjoyed that. And even now, after the course is done and preparing for the MPTE, I've gotten all the support that I needed in answering questions and working through some of the issues that I have as far as studying goes and preparing for the exam.
Thank you, Amanda. I'm just going to say, does anyone have any questions that you'd like to address specifically to Amanda as a graduate? If you do, you can put them in the chat box on the left, and we can answer those. I was really excited when Amanda said that she would be willing to talk to us, because when Amanda first came to me and said she was interested, she wasn't quite sure that this was the path she wanted to follow, and I tried to reassure her, and she just really blossomed as she went through the program. She really put the time in coming to open labs, meeting with Dr. Formanti or myself to make sure she truly understood the information. She took advantage of the opportunities that our program gives, and I think she learned a lot about herself. I know at one point she said she changed how she studies, how she takes notes, and how that really helped her. So it's just so exciting to see all of our students go from that nervous person on their interview during the admissions process to grow into confident clinicians throughout the program, and then to walk up the stage and graduates. And we're excited she's going to be taking the NPTE in a couple weeks, and she's really right on track with all of her studying. Were there any questions that anybody posted? Olivia is typing. Amanda, anything else you wanted to include?
No, I don't think so.
Okay. And then it looks like somebody is taking a question. We will get to that question during the question and answer session.
Amanda, what is your educational background? Did you start the program from high school or start your career and went back to school?
Okay.
So I was actually, I had done a little bit of college here and there. I could never choose, sorry guys, I could never choose a major. I could never decide what I wanted to do. So I was in the service industry for a very long time before I chose PTA. And when I decided to go to Bryant Stratton, I actually started from the beginning. It had been so long since I had been in school that I actually did all of the coursework like I had no college experience at all.
Any other questions for Amanda? Brian, we have one here on campus for you, Amanda.
My question is, when you were going about studying for your exams and NPT, what's some advice that you would give about going about studying for those and taking those as well?
So my advice when it comes to studying for the exam is to be prior to even beginning to think about studying for the exam, you need to really learn how you study and how you prepare for tests. So the way that you're studying when it comes to like exams, like for your coursework, and when it comes to practicals, you really need to hone in on what you're doing right and what you're doing wrong, and then bring that with you when you're studying for the NPTE. I was somebody that, like, when I started the program, I always used flashcards, and I had really struggled through exams. I got nervous, and then once I kind of like got rid of the flashcards and really determined that my studying started with the way that I was taking notes, it really, really helped. Now, as I'm going through and studying for the NPT, I'm going through my notes. Like every question that I'm getting wrong during my practice exams, I'm able to go through my notes and like pinpoint what I wrote myself to remember certain things, or little notes that I wrote myself to really like embed that knowledge and like reroute it to the way that I learn.
Yeah. Okay, and another question?
Olivia is asking if you don't mind sharing, where do you work now and what part of the program has been the most useful in terms of like a real life application?
So I'm still working in the restaurant now in hopes of being able to work in a skilled nursing facility once I pass my NPTE. But I feel like the most important semester is actually the last two. So those full-time clinicals were extremely important because you're really getting like that hands-on. You're really learning what you're going to be doing in the clinic. But that semester prior to it really prepared us. It kind of like brought everything together that we had learned the three semesters previous.
Thank you, Amanda, very much for speaking about your experiences and answering their questions. We really appreciate it. And what Amanda was saying with how she looked at how she studied and made some adjustments, Dr. Bryant and I meet with the students, and they are always more than willing to sit down to address, are you somebody that's more a visual learner, so you want to watch videos? Do you need to hear the information? Many of our PTA students are kinesthetic, so they need to work with the hands and practice over and over. So that's why we have the open labs. So we are here, we've worked with people on scheduling their time, worked on test-taking tips. Amanda, I'm going to give away one of your secrets, that she used to second guess herself. And so we talked to her about that, and she's not in PTE because she's much more confident now, and she's going to put that right answer and pass the test. In Ohio, you cannot start working as a PTA. We do not have any provisional licenses. Other states do. So our graduates cannot start working as a PTA until they have passed both a laws and rules test and the NPTE and have received their license through the state of Ohio. So With the NPTE, it's just on 4 days during the year, so the test that the graduates will be taking is in early July. So once that is done, they've already started the application process through the state of Ohio. So hopefully by August, we will be seeing them in the clinics. So thanks again, Amanda. Right. So Amanda's in the situation. She is at home. She's preparing for her NPTE, but she also has another resource, and that's our Career Services Department. Throughout their program, our Career Service Department representatives come to our classes. They talk to the students about writing a resume, interviewing techniques. They're on the panel when the students do their portfolio presentation. They will do mock interviews. And then the best part is that they send out job leads to the graduates. And let's say a graduate gets his or her first job, they're in it for 3-4 years and want to make a change. You can come back to our Career Services Department basically for the rest of your life to get assistance with preparing your resume, the mock interviews, and other job leads. So it's a great relationship that our program has with the Career Services Department. Probably our most important relationship for our program is with our admissions department, because they're the person that is going to be greeting you. They're going to take you through step by step the process. And so I would like to introduce Sharisa Werner. She is a master admissions representative to talk to you today.
Hello, everyone. So we talked about all of the great things about what happens when you're in the program, our Career Services Department. Better? Okay. Our Career Services Department and the things that we can help you with when you're done with school. Let's talk about what we have to do to get you into the class, to get you accepted, what you have to do to get started. So there's a couple of different things. First and foremost, there are some requirements as far as GPA is concerned. You have to have a minimum of a 2.5. And that is the minimum for the GPA. I know we talked about prerequisites and the wait lists and that type of thing. When we talk about prerequisites for the PTA program, most people think about prerequisites for like college classes, right? So the prerequisites that we talk about are not specific to college courses. They can be done in high school. So you have to have at least a biology class and a chemistry class. Or you can have physics instead of chemistry. If you have all, Tech and me, we're not friends. I think I deleted the whole thing. So you can have all three. You can have the bio, you can have the chem, and you can have the physics. And that is a great thing. In addition to the 2.5 in the bio and the chem or physics, there is an evaluation that you take. It's a math evaluation and an English evaluation. Once you talk to your personal admissions advisor, they will go over the specifics for the testing for the program. You will also have a one-on-one interview with Mrs. Frank, the program director for the program, and at that point, she will determine your acceptance. There is one thing that a lot of other PTA programs require. It is not a requirement to get into our PTA program, but it is definitely a benefit, and that is observation hours. So if you've done any job shadowing or anything like that, that is definitely something that we can take into consideration as well. I know we talked about not having a wait list. However, we do only start the PTA program once a year in September. We are only able to accept 12 students into the program. So it's super important that if it's something that you're interested in, if you're super excited about getting started, you schedule and you call your admissions representative and you schedule a one-on-one personal phone interview with your admissions representative. They can talk to you about specifics when it comes to getting into the program and scheduling your testing and that type of thing. One of the really great things that Bryant Stratton does is we match scholarships. So there's a lot of really great scholarship opportunities. We have GPA-specific scholarships as well, only for our PTA program. So you really want to make sure that you call your admissions rep, you schedule that appointment. I know that our first deadline is July 10th, where we're looking to accept half of the students for the program. So you want to make sure that you talk to your advisor so that you can start scheduling your testing and those types of things and ask those specific questions to your situation.
Thank you very much. So today you've really heard a lot of information, and I know it takes some time to process this information, but we would like to take a few minutes to answer any questions that you might have. If you're online, you can put it right in the chat box if you have a question. Bryant, any other questions?
About the application test, is that being made virtual or joint person?
We can do either, correct?
Yes, so we can do either one. That's where you just call your advisor. You talk to your advisor. Your advisor's going to know your schedule better. So we can definitely work with you in making sure that we figure out what's going to be the best option for you and go from there.
Any questions online, Dr. Formanti?
Not currently.
Go ahead.
For the labs, what are some of the skills that will be taught in labs?
It varies by class. So the first lab class that you have is Foundations of Physical Therapy. So one of the first things we do is you'll learn how to take all the vital signs. You learn how to do bed mobility with patients, how to transfer patients. Eventually, you learn how to size and fit the various assistive devices. So how to set up a cane, a walker, crutches for a patient. Then we also teach you how to gait train, or how to basically help the person regain their normal walking. You also have kinesiology, and with that class, you are identifying bones, muscles, landmarks. So you'll be doing that in the lab. In the summer classes, we have data collection, which is how do you manual muscle test? How do you check someone's sensation, their balance, their cognition? The modalities, which the equipment that you see around here, the traction table in front of you, you'll learn how to use that. You'll learn how to use electric stimulation, our diathermy machine over here, or the ultrasound machine. In the fourth semester, you have a musculoskeletal class where you will learn some special tests that are done to test various body parts. You learn a lot about wheelchairs and how to make sure the wheelchair is properly fitted for the patient. There's a neuro class where you are learning about infants and their development and how to facilitate normal development. And you also learn about how you would transfer someone that has had a stroke or had a spinal cord injury. The last lab class is an interventions class. So how do you test someone's aerobic capacity? How do you help them with assisted coughing? Things like that.
Olivia had a question.
Okay.
She is wondering, how do you schedule an appointment with an advisor?
Okay, Olivia, I'm glad you asked. On the next screen here, we have my contact information as well as Andrea Inman. She is our director of admissions. You could send an email to her, or you could call the campus at 216-265-3151 and let them know that you're interested in information about the PTA program, and they will put you in contact with one of our admissions representatives. Any other questions? Yes.
How flexible are the other labs? When are they really set, or can be really scheduled?
Normally, we do have a set open lab schedule, and we look at the time when you're on campus and try to put it usually after a class. But Dr. Formanti and I are both here full time. So normally what students would do would be make an appointment with us. So like Amanda mentioned, she's an early riser. So Dr. Fermanti and I are usually here by 7:30 or 8 o'clock. So there were some days where we would meet with somebody from 8 to 8:30 to do open lab. Or if somebody had to stay later or come on a different day, as long as you schedule it with one of the instructors, we're very flexible. Any other questions?
Olivia's typing something.
Okay. We do want to thank everyone for joining us today, and we will continue to answer the questions, but I think the best thing for you to do is to reach out either through email or calling the college, because your admissions representative is going to be a great resource and walk you through the steps, set you up with a financial aid advisor, and I will get to meet you when you come on campus, or we can do it through a virtual interview as well. She's still taking? Okay.
Oh, here it is. Are you able to complete the program in under 2 years? I will have a bachelor's in exercise science in the fall of 2020 and will apply for fall of 2021, and was wondering how or if credits will transfer. I have sent my unofficial transcript.
Okay. Thank you for the question, Olivia. Our registrar looks at the transfer credits, so she would be the one that would make the determination. The program is set for 5 semesters, but we have had students in the past that come in with transfer credits, so usually their first or second semester there's not as many classes that they have to take because the general education classes have transferred in. With the 5 consecutive semesters, we do 3 semesters a year. So we start the program in the fall, and then you would have classes through the next fall, and then January, a year and a half later, is when you would do your final clinicals and then graduate. Do you think of another question? You look like it.
What's the course work typically like on a day? How long the classes per se?
It's really going to depend on the semester and if you have any transfer credits. I would say like the summer semester is all PTA classes. Usually that's 2 full days on campus with classes and 1 day in the clinic. So, and a commonly asked question is, can students still work while they're doing the program? Students can, and they do. Many times, though, they will reduce their workload, especially once they get into full-time clinicals, because as the name implies, full-time, you're in the clinic full-time, and then you're also studying for your NPTE. Any other questions right now? No? Well, again, thank you, everybody, for joining us. We are excited and looking forward to seeing you start in our PTA program in September. Please make sure you reach out to myself or our admissions department, because we want to see those applications when we look at them on July 10th. Thanks for joining us. Have a great afternoon.